Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Early versus the late dumping. So let's look at the early dumping first. So here in early dumping, the incidence is about 5 to 10%, and the relation to the meals is immediate. And what is the duration of attack? The duration is going to be 30 to 40 minutes. So relief will be by lying down. So how is the relief? Is by lying down. So how is it aggravated? So it is aggravated by more food, by increase in the food, that is presence of more food. So how is it precipitated? The precipitation here is by the carbohydrate rich food. So carbohydrate rich food, it is precipitated by. Now what are the major symptoms? The major symptoms, it includes the epigastric fullness. So you have epigastric fullness, and there is presence of sweating. There are some light headedness. There is tachycardia, as well as there is colic, and there is sometimes the presence of the diarrhea. Now let's move on to the late dumping. So here in late dumping, what is the incidence? The incidence of late dumping is about 5%. And what will be the relation to the meals? Compared to the meals, the relation will be, it is in the second hour of meal. This second hour of the meal. And how is the duration of attack? The duration is going to be again 30 to 40 minutes. It is very similar to that of the early dumping. Next is we look at the relief. So relief, the late dumping is nothing but relief is by administration of the food. Then what is this aggravated by? So when you look at what is it aggravated by, the aggravation is by the presence of exercise. Whereas in terms of early dumping it was food, here it is going to be the exercise. Next is how is it precipitated? The precipitation here is same, that is it is carbohydrate in terms of both. So it is carbohydrate, and this carbohydrate is present in both rich food. Now how is the major symptoms? The major symptoms, it includes tremors. So there is tremors, as well as there is faintness, as well as there is prostration. So all these are the major symptoms. To learn and grow daily like this, please do subscribe.